Those who work within the child welfare system in Pennsylvania say there are challenges. The current system is mostly county administered with state oversight. In tonight's Children of the State report, Fox 43's Grace Griffithson spoke with attorneys and advocates about the biggest obstacles they see and what they see needs to be becoming the priority.
I would say the most challenging is working within this system. In the state of Pennsylvania, we're a county-run children and youth state.
Yeah, 67 counties.
Yeah, so 67 ways to do things.
Nicole Mulholland says it makes serving children more of a challenge. She's a manager for Presley Ridge Foster Care and Adoption in York and Lancaster counties.
We have counties who have stopped drug testing. We have some counties who, if the parent shows up for a visit and they're under the influence, they'll stop a visit, and other counties who will allow the visit to continue.
Everything from how do you screen a call that comes in, what kind of service array do you have, how do you supervise cases. The reality is that's all very different.
Kathleen Palm is 25 years working to improve systems that intersect with children and families. She's also the founder of the Center for Children's Justice.
Could one county be overwhelmed and another county is doing perfectly fine or has enough resources?
You know, that is part of what I think is a challenge. Like, everybody's going to necessarily get some basic stuff, but for all of the added stuff, you may not have it.
Palm says it's not just resources that can vary.
Your tolerance level of a parent's substance use may be very different than my tolerance level of a parent's substance use. You might be like, oh, you know, she's just using this drug, that's okay. Oh, she's a white woman living in suburban, you know, Dauphin County, she's okay, versus, oh, she's living in Allison Hill. And so much of this work as
subjective.
It's subjective, it's filled with bias.
For family law attorney Wendy Chan, it's not how things are viewed, but what she says isn't addressed enough.
Not everybody is aware that mental abuse is part of our Child Protective Services law.
Recalling what she considers the worst example during a custody case she handled.
We had a teenage girl once who was so distraught by how her mother was treating her. She was cutting on her leg, on her upper part of her thigh, so that no one can see it.
Certainly, our workers are trained for and are looking for children with anxiousness or fear, chronic mental health conditions.
Though they are trained, John Rubin says caseworkers are limited by the Child Protective Services law. He's the Deputy Secretary for the Pennsylvania Office of Children, Youth, and Families.
Our caseworkers can't make a determination of emotional abuse without a licensed psychologist or psychiatrist saying that the child has a serious and chronic diagnosable mental injury.
While caseworkers' decisions may seem subjective, Rubin says they're made based on the same guiding principles.
In the best interest, health, safety, and well-being of a child, and how do we keep them connected with their family.
Counties can have different resources and structures based on the local need, but all caseworkers receive the same training, 120 hours minimum in the field and in the classroom.
We are certainly trying to shift our system to be more preventative in nature.
Pinwheels for prevention taking place in Lebanon County.
We have to sincerely say we can prevent child fatalities. And if you don't believe you can, you're not going to prioritize it.
For more on how counties in PA are promoting prevention, head to our website, fox43.com. Grace Griffithson, Fox 43 News.